Welcome back to Oppurtunity. I am PRAVEEN here. So today we are going to take an interview with Rutwik Bro. So he is studying 4th year MD in DMSF, and also he is the former president of IMD Council of DMSF. Okay, bro. First of all, second year. What you are thinking about second year?
Well, the second year I feel is one of the most crucial part of our medical course, medicine we are studying. I feel that when we completely check on all the basic subjects of first year, anatomy, biochemistry, physiology, where we'll be learning all the normal functioning of a body, normal structure of a body, histological side of our body. But second year is the door where we'll be entering the clinical part. This is the opportunity where we can develop our clinical eye, where we can just check on the clinical sides of the things, whichever we learned in our first year.
Okay.
So I feel that second year is most important, and I really want every one of us to take it very seriously, because being in fourth year, I realized that this second year stuff like gen path, pharma, micro, parasitology, all these things are very correlated, whatever we do in fourth year.
Go to next question. So definitely second year is gonna to be very hard. We already know that because I'm experiencing that. Just tell me why second year is for you. What's your personal opinion? Why everyone is fearing us, making afraid of second year? Just tell me what is the how to overcome from this fear of second year.
Second year is tough because it needs a proper attention, proper time. It's like one should be smartly studying in second year in spite of mugging up or being back off, clearing the concepts and portion.
Okay. Now I'm going to ask you in a subject way, because you're going to explain us what you exactly studied in a subject wise, starting from pharmacology. What you did for your pharma.
Okay, see, everyone will be having their different ways to study the subject, but what I did, I would like to share with you was, see, when we start reading a clinical chapter, like where we will be seeing the drugs, first the basic in Goodman-Gilman, first 7 to 8 chapters, I guess, all these are basic pharmacology, like pharmacodynamics, pharmacokinetics, all these mechanisms, roots and all, that basics you will be clearing out there. But whenever you check on the chapter in which you will be finding all the drugs and all, talking about Goodman-Gilman, first of all I would like to clear that for Genpath, Pharma and ASM, at least for these 3 subjects is must for everyone to go with the books. Even though those books will be in a very huge set, even though that volumes will be very big, but it's must for us to go with the book. So for me, what I did in pharma was like mostly Goodman-Gilman contains research. So in the first reading, whenever I used to read the pharma book, there I used to highlight the other part other than the research. So doing this, only the most important part which I have to read in my second reading was non-research part, which I will be already highlighting in my book. Again, there will be a table back of every chapter, right? So what I used to do is, in that table, I used to check what is the extra part given in the chapter, but which is not in the table. Anyways, table gonna be the summary of chapter, right? But there will be still few points which won't be mentioned in the table, but it will be there in the chapter. On the first reading, we will be knowing those things, right? So what I used to do is I used to write those points in the table itself. And when I used to check the PPT, again I'll be comparing that in case if there is a new point in the PPT but which is not in the chapter as well as the table, I used to again write in that table itself. So instead of reading book, instead of reading PPT before the exam, if I just read that table, there my book as well as the PPT as well as that tables revision, everything get covered into this thing. This is what I used to do. So whenever we will be having our term exams where we have to learn, we have to read for our 15 to 30, 15 to 20 chapters.
Okay.
As in whole. Whereas it used to be easy for me because I just had to read only those tables.
Okay.
You get it?
Yeah.
Here, just I read all these chapters as well as PPT. It used to be very easy for me just to go with these tables, and my I used to be very clean and clear with my mindset that at least I have cleared my book, my PPT, as well as the table. So it used to be at least a bit of confidence. It used to be with me before appearing for the exam.
Then we done with pharmacology. Then just tell about GenPath. In GenPath, personally, I have big problem in this moving exams in DMSF. And also, just tell me any advice for GenPath.
For me, even it was very difficult to pass all the lab exams and all, because to develop that how to check on the histopathological sites. Practice is very important over there. We should see all the slides, number of slides there will be, where we have to study it very thoroughly. But talking about lecture as a theory lecture part, yes. I feel Robbins is a very beautiful book. Where if we get to know how to read that book, it's gonna be very easy. First, it's obviously fine if it's getting very difficult in first few chapters. But whenever we start reading, just go and continue the reading part. Then you will know how beautiful that book is, because it's very clear, and your pathological mindset will really get developed over there. So book reading is must for GenPath. There is no shortcut for that.
We are going to microbiology as a major subject. So what you did for microbiology, just tell us about micro.
See, micro and para, we were under Doc Bandalan and Doc Salavar. So first of all, those subjects are very interesting because we'll be learning there all these infections, bacterial, viral, fungal and parasitic infections over there. So there will be lot of things we have to mug up, like intermediate host, definitive host of these things, that things we have to check on the life cycles. Again, there will be all this families of virus and all these things. So I can understand that's a very volatile thing. One will be easily forgetting it. But at second year, it's expected from a second year student that at least we should read all those things and we should try to remember it, keep it in our mind, because in clinical duties, these are the most cases which you will see, like dengue will be there, again all this parasitic infections in children, pediatric cases will be there, again bacterial infections and all those are very common infections found out to be in hospital and wards rounds. So I feel that we should properly make notes of that, because see, the notes we will be preparing only will be the source which we'll be preferring for our revisions. We won't be going back and reading again all the chapters and all. So I feel making note is very important.
After that, I forgot to ask you that clinical path. It's one of the toughest subject while compared to pharma and GenPath, because we are getting low grades in clinical path normally in every sections in our batch. What's your advice for clinical path?
See, even clin path was not that easy for me as well, but I feel that subject or the questions asking those exams will be tricky. So we have to be very attentive while our exams, even though we have read all this PPTs, books, those questions will be a tricky type. So we should be very attentive while attending each and every question. So it can help one to at least pass the exam, because honestly speaking, even it was hard for me, but I used to manage it just by trying to cover every single chapter or every PPT which I used to get from my doctors. So that was the way I used to appear for my exam, and sometimes I used to fail, but it's fine. failing
Okay.
is, I don't take it failing as a bad thing, because
Okay.
that will be the motivation which we'll be getting for
Okay.
appearing for the next exam.
Okay.
So this is how I used to do with my clean path.
Okay, bro. Then neuroscience and research is left in the first sem, I think so. When it comes to neuroscience, before going to research, what about neuroscience?
See, neuroscience, whenever we start with neuroanatomy in the first year,
Okay.
all these subjects are linked to each other. Neuroscience will be there in first sem, second year, second sem there will be neuropsychiatry. And again third year you will be having the same subjects. Even in the
Okay.
fourth year there will be psychiatry. So all these subjects are linked, I feel.
Okay.
So if you want to be good in your psychiatry or neuroscience in third and fourth year, you should at least read those subjects.
Okay.
I'm not asking you to go and give completely 3-4 hours of your day for
Okay.
neuroscience, at least in the second year.
Okay.
But at least read all the PPTs, materials provided by the doctor, so at least you will know the basic of that subject.
Okay, okay, bro. At last, research. So we also this is a time some of them are going research remedies and classes. So in case in future, what in first year students are doing, when it comes second year, what your advice? How we can study research, because we don't have any books or anything are recommended by the doctors. So is there any books for the research, or what did you study for the research actually?
See, this is what I feel. Compared to the students studying in foreign universities like outside of India, we IMDs will be taking this subject very lightly. Like people won't be interested in research, okay, where there's a huge importance for this subject. When we check on this other international licensure exam like USMLE, AMC, PLAB, where research is very very important. They'll be asking it for sure. But taking on this research in first year, second year, again in the community medicine in fourth year you will be having research. You have to do research actual in the community setting. I feel being attentive in this research classes is way more than enough, I feel. And again coming home and just going through the PPTs.
Now we are stepping into the second sem. So second sem we already read about GenPath, Pharma, everything it comes up. So in GenPath, what are the extra subject? For example, in neuroscience it was changed to neuropsychiatry. Then micro it was changed into parasitology. So what are extra subject, minor subject you will get, and just let me know about second sem.
See, second year, second sem I feel keeping this fourth year clinical part aside, in all these first 3 years, second year, second sem is most toughest, I guess.
Oh.
Because there, with the same subjects which we'll be learning in the first year, second year, first sem, 3 more minor subject gets added there. That's surgery, pediatrics, and OB/GYN.
Yes.
So, checking with all these first years, second year, second sem major subjects, you have to manage even those minor subjects, which are as major as the second year major subjects, that is GenPath, Pharma, and parasitology. Again, I feel this second year minors are the base of your clinical subjects, because these are the same subjects you will be learning in all this third year and fourth year.
Okay.
So I feel we should really take it seriously as well with others major subjects. See, micro and para, it's gonna be the same. Like the way we have did it for the micro, we can do it same way for the parasitology as well. Even the neuroscience, the same way of studying neuroscience can be applied for the same as in neuropsychiatry. But here again, checking with all these 3 subjects, even though they are minor, but we should really take it as a major subjects.
Okay, bro. So what about, can you elaborate about minor subject, OB/GYN, surgery and pediatrics? Just so I know about.
What I feel is pediatrics is same as like biochemistry. That is one of the again volatile subjects. Even if we read it, we have to mug up things. For example, this milestones and again all this vaccination schedule and all. There is no logic, or there won't be a good way. Like people do mnemonics and all. But for me, it was completely like I told you I'm not that good in mnemonics and all, so I had to keep it in mind that okay, in this month we have to give this vaccine,
Okay.
or at this age, this is the normal milestone which should be occurred, or all these red flags and all. We have to just memorize it.
Okay.
Okay, so pediatrics is most likely it will be needing a revision part.
Okay.
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 OB-GYN and surgery. Talking about surgery, for me, honestly, surgery was most hardest of those minor subjects,
Okay.
because those, first of all, there will be two books. Mostly Schwartz will be preferring, and even
Okay.
sometimes doctors will be asking questions from Sebastian as well.
Okay.
Okay, so considering and comparatively to all these two other subjects, that is OB and pediatrics,
Okay.
surgery will be a bit tough.
Okay.
Again, OB-GYN, if you go with the book,
Okay.
it can make your exams and your life easy.
Okay.
But if you just go with the PPTs,
Okay.
it's gonna be difficult for sure.
Okay. At last we're done with every subject of second year. Then my next question is the time management. So how you are telling that you read books and you taken notes and you did every effort, but so for everything how you manage your time, that's very important for guys.
And time management, again, see like how you do it. If you, for example, see 6 hours, minimum 6 hours sleep is necessary.
Yes.
But again, except those 6 hours, you have rest of the time.
Okay.
So you can just utilize it in gaps between lectures. No lecture will go all for a complete 2 hours. Okay.
Okay.
So those gaps we can just fill it out by reading the book, or at least building those concepts.
Okay. Okay, bro. So we just talked about starting from the first sem to second sem. So what's your final message to our second year students?
Second year I feel is very interesting year. Okay, where we'll be knowing all this clinical side of our medical course.
Okay.
So just take it easy, even though if it's hard.
Okay.
If we manage it accordingly,
Okay.
or if we are good in our time management, if we are good with the consistency of reading,
Okay.
if we are giving equal hours for all the subjects according to their weightage,
Okay.
I feel we can still make it in second year, because even though if it's hard, it's not impossible. So the message I would really like to give for all second year students is like,
Okay.
do not read for exams.
Okay.
Okay, read it for developing your clinical mindset. Read for
Okay.
building your foundation in that subject. If you do all these things, obviously exams will be going good for you guys.
Okay. Apart from our lectures, doc lectures in our campus, in our school, so what you learn from the social medias like YouTube? So we used to, for example, for anatomy or something, Nazif videos. So what you have read from the YouTube?
See, what I'll say is,
Not
never-
only YouTube, from the social medias and
Okay.
other.
honestly speaking, nowadays many will be using those Marrow apps, Prep
Yes.
Ladder apps. Again, Dr. Nazib's video will be there on the YouTube and all.
Yes.
But what I feel is like one should go with the book first.
Okay.
In case if it's gonna be hard for one to understand, or if there is very difficult portion in that or part in that, then one can go back to those videos or whatever source you have. Yes.
Okay, so if I want to ask, I will ask so many questions. So let us end up with this. So thank you for your valuable time, bro. Because I know that you are fourth year med students. You will be having clinical rotations and many steps. So thank you once again. Thank you for valuable time, bro. So before ending up the video, for every guest, I will be asking that subscribe to my channel. So just tell us, subscribe to our media.
Please subscribe to Oppurtunity channel.
Okay.
Thank you.
Thank you.